So we have to remember that gestational trophoblastic tumors are rare tumors developed in the placenta of young patients during pregnancy. And the standard treatment rely on chemotherapy, either single-agent chemotherapy for low-risk disease or polychemotherapy for high-risk disease. But outside chemotherapy, there is no innovative treatment available for this disease. So the idea was to see if we could develop some new approach outside chemotherapy for GTT resistant to chemotherapy. Because if chemotherapy is very effective, it is also toxic with sometimes very important immediate and long-term side effects. And there are patients who resist to chemotherapy. So there was really a need for new treatment. And we had a strong rationale for thinking that immunotherapy and especially Avelumab would be effective in GTT patients. So that's why we designed the academic TROPHIMMUN trial. So it's a phase 2 trial where patients with resistance to chemotherapy are treated with Avelumab given IV every 2 weeks. And the primary endpoint is the rate of patients with HCG normalization that enabled Avelumab discontinuation. And what we wanted to see is how many of these patients wouldn't present any relapse despite treatment discontinuation. So Avelumab was continued until normalization of serum HCG and then continued for 3 consolidation cycles, and it was stopped then. And the results we presented were about the cohort A, where these were patients with resistance to single-agent chemotherapy. There is also a cohort B, which is ongoing, with patients with resistance to polychemotherapy. And we reported the results of cohort A. And so we enrolled 17 patients. Out of them, 15 patients were treated and accessible. Out of these 15 patients, 8 patients had HCG normalization with Avelumab. And with a 29-month follow-up, none of them have relapsed despite the Avelumab discontinuation, meaning these patients are likely to be cured. So that means that actually it would be like a successful HCG normalization in about 53% of patients. There are 2 remarkable outcomes. The first one is out of these 15 patients, 5 of them should otherwise have been treated with polychemotherapy because they had high HCG or because they resisted to both standard single-agent chemotherapy. And these 5 patients were successfully treated with Avelumab. So they really could be prevented from the very high toxicity of polychemotherapy regimen. So I think it's very important. The second very interesting result is that one of the patients who was successfully treated with Avelumab wanted to be pregnant. So she was allowed to stop contraception 1 year after Avelumab discontinuation, and because her HCG were normal. And actually, as soon as she stopped contraception, she developed a pregnancy, which was perfectly normal, and she delivered a very healthy baby. So that's very interesting because this was the first report of a normal pregnancy after a successful previous treatment with immunotherapy. So of course, it's not an evidence about the lack of consequence on subsequent fertility, but it's a very reassuring data. And finally, the safety was very good. Patients presented very few side effects, much better than chemotherapy, I can tell, based on my experience. So we're happy with that. So in conclusion, it shows that first, it's possible to make a trial in such a rare disease because we have the French Gestational Trophoblastic Center with a network of centers and where we could perform the trial. So first, it's feasible. Secondarily, it's a proof of concept trial, which confirms that immunotherapy is very promising in these tumors. And moreover, it shows that about 50% of patients with resistance to single-agent chemotherapy could be successfully treated with Avelumab. They normalized HCG and none of them relapsed. So that's very nice, suggesting they are likely to be cured. So probably it's an option for patients who have resistance to single-agent chemotherapy, but especially those who should be treated with polychemotherapy because we could avoid in these patients a very high toxicity of polychemotherapy.